Hi, my name is Carrie Boyle, and I'm a licensed acupuncturist. I've been in practice almost 20 years, and I've had the great fortune of being able to introduce thousands of people all around the world to their very first acupuncture treatment. A lot of them have had the same questions, so I thought I would record the answers for you today in case you have some of these questions about acupuncture. And what people want to know before they try it is, how does acupuncture work? And what conditions does it treat? What's a treatment like, and does it hurt? What are the requirements to be an acupuncturist? And how can I find an acupuncturist near me? So we'll cover all those today. But first, why are so many people trying it right now? Maybe you've been referred to try acupuncture by your doctor, or maybe your friends and family are urging you to try acupuncture for your condition. Well, the simple answer is it's becoming more and more accessible in the United States. There's more acupuncturists practicing, and there's more places to interact with acupuncture. You might see it at your specialist's office, like in a cancer center or a fertility center, or you might try acupuncture in a spa or on a cruise ship. It's all over these days, and I want to make sure you find a great acupuncturist. There's also more accessibility through insurance coverage. In the US, insurance companies are starting to recognize that acupuncture can save them money and reduce people's pain. So the Veterans Association is covering acupuncture, and Medicare and Medicaid are about to start covering acupuncture for low back pain. So to talk about acupuncture, we really need to talk about the 5 branches of Chinese medicine, of which acupuncture is one part. In addition, a licensed acupuncturist is skilled at providing herbal medicine, nutritional advice, manipulative therapies that could be like cupping or massage therapy, and Tai Chi Qigong exercises. And this might be like meditation or breathing techniques. So don't be surprised if you go to an acupuncturist and you leave with an herbal prescription or diet recommendations. You might receive massage therapy or cupping for your condition, or you might be going home with new meditations or breathing exercises to try. So let's talk about a little history of acupuncture in the United States, which is quite brief because acupuncture has actually been around for thousands of years. It is the oldest recorded medicine in the history of the world, and we know it's been around for at least 3,000 years. But it took until 1972. In that year, Mr. James Reston of the New York Times went over to China to report on the opening of the gates, where President Nixon was going to visit to discuss trade negotiations. Unfortunate for him, but fortunate for us, Mr. Reston experienced an appendicitis attack and had to have an emergency appendectomy. While he was in the hospital, he received acupuncture to help mitigate his pain after surgery. Mr. Reston was so impressed with his pain reduction that he asked to receive a tour of the hospital, where he saw brain surgery and open heart surgery being done with acupuncture as an adjunctive to the pain medication to reduce pain during surgery. He was so amazed by this, he wrote about his experience and what he saw in the hospitals in China in the New York Times in 1972. At the same time in the 70s in New York, the Lincoln Recovery Center was finding out that acupuncture could be incredibly effective for helping addictions, and they were bringing acupuncture to the Bronx to help people with heroin addiction. In 1992, the United States FDA declared the acupuncture needle to be a medical device, and this is why you need to have a license in order to practice acupuncture. As we're moving ahead, 2020 brings the coverage of acupuncture via the United States system of Medicare, and more people will be able to access it. So what does acupuncture treat? Well, a lot of things. The National Institutes of Health and the World Health Organization have a whole list of things that acupuncture treats, and they know these things from research. There is a lot of research on acupuncture. In fact, there's more research on acupuncture being effective than there is physical therapy. Here's a list from the World Health Organization of conditions that acupuncture effectively treats, and there's research to back all of these. The number one reason people see an acupuncturist is for pain. All kinds of pain. Low back pain, knee pain, joint pains, arthritis, sciatica. In fact, acupuncture beats some pharmaceutical drugs for pain relief in certain pain conditions like migraine headaches. Another thing we treat a lot is women's health. This is something I'm a specialist in and have help women with infertility and PMS, menstrual irregularities, and symptoms of menopause. Stress is the underlying condition of so many symptoms and conditions, and acupuncture treats it really well. From smoking cessation to depression, anxiety, and insomnia, reducing stress is absolutely something that acupuncture is effective at. The digestive system and the respiratory system are also benefited from acupuncture. Conditions like irritable bowel syndrome and Crohn's disease can be affected, as well as respiratory conditions like asthma, tonsillitis, sinusitis, and allergies. So what is a treatment like? Well, I practice traditional Chinese medicine and acupuncture, but there's a lot of different forms of acupuncture out there. So I'll tell you about what a treatment is like in my clinic. After a thorough intake of asking a patient questions, I come up with a differential diagnosis according to Chinese medicine and a treatment plan. And that plan usually involves acupuncture. The amount of needles I use varies, but we could say about 12 is an average. The places I put the needles also varies. If someone is coming in with back pain, there's a good chance that there's going to be some points in their back. But you might be surprised to find out that some of the most effective points for pain are in the hands and in the feet. So sometimes I don't have people disrobe at all. They just rest on the table. And other times I have them underneath sheets covered and have the acupuncture needles in their back. After I insert the acupuncture needles, which does not hurt, they're very small. They're about the size of 4 human hairs, and they are with a guided insertion tube. And this tube works for 2 purposes. 1, it allows the needle to go in really quickly so the brain doesn't feel it. 2, the brain is busy processing what's resting on my skin as it feels the insertion tube, so it doesn't feel the needle go in. After the needles are inserted, there is a retention time. I like to give people about 30 minutes. We've found this is an effective amount of time for pain to reduce, for conditions to be improved, and for patients to relax. During that time, it's common for people to fall asleep. They also might feel waves going up and down their body and feel very heavy on the table. A lot of people are surprised when the 30 minutes has gone by because they've rested. So some people want to know, what are the differences between Eastern medicine, which would include acupuncture, and Western medicine, which is modern medical system of pharmaceutical meds and also surgery. Well, one thing that acupuncturists do is we look at the whole person. So as opposed to looking at individual pieces of the body, like Western medicine does with specialists, going to see a gastroenterologist for one thing and a pulmonologist for another, your acupuncturist is more of a generalist and looks at the whole body because we recognize that the systems might be interacted and connected. We also look at the root of the problem. I'll give you an example. If you think of somebody with sinusitis, really stuffed up nose, maybe sneezing, maybe a sore throat, the underlying cause of that could be variables of things. It could be allergies from seasonal allergies. It could be a gastrointestinal issue and allergies of food. It could also be an immune compromised situation. So as the acupuncturist, I'm going to differentiate what is the underlying cause of that and hopefully have my patients leaving with less congested nose. A modern medical Western doctor might have those same 3 folks come in with the same complaint of sinusitis, and all 3 of them might leave with the same prescription of a pharmaceutical medication. It might also treat the sinusitis effectively, but what's great is that you have the choice. Integrative medicine is about working together. So at our clinic, we always contact the Western medical doctors of our patients and let them know what we're doing with the acupuncture. So, how does acupuncture work? Well, we've known how acupuncture works according to Chinese medicine for thousands of years. But in recent decades, modern medical science wants to know, how does it work? So they do blood draws and CAT scans and try to figure out what the difference is before and after acupuncture. So here are some theories The first one is the circulatory theory. I like this one a lot because you can see it and you can feel it. Have you ever gotten a splinter and maybe left it in? Your body is going to naturally try to push that splinter out of your body because it recognizes it as a foreign object and knows that it needs to come out. Well, the body responds the same way to an acupuncture needle. It increases the flow of blood and relaxes muscles around that foreign object of the acupuncture needle. So it turns out to be very effective that if you have, say, back pain, and we put acupuncture needles in your back to have your muscles relax and the blood flow increased around those needles to have pain reduction. The next theory is the endorphin theory. You've probably heard of endorphins. It's what's naturally released from your brain when you exercise. Well, there's a certain type of endorphin called an enkephalin that is incredibly good at managing pain. In fact, it's stronger than morphine, and it's naturally produced in your brain. Acupuncture stimulates the secretion of these enkephalins, or endorphins, from your brain and provides pain relief. Next is all about the immune system. So same theory as when you put the acupuncture needles in, the body kind of takes inventory of what is this foreign object. And another thing that is affected is the immune system. The body thinks there's been an injury of some kind, and so for natural protection purposes, it's going to increase the production of white blood cells. This turns out to be very effective for our immune system and is why acupuncture can be great just for maintenance of health, well-being, and prevention. The neurotransmitter theory has to do with serotonin and noradrenaline. You've probably heard of these. Serotonin is what's said to be lacking in depression. Well, acupuncture creates a natural increase of the levels of the neurotransmitters of serotonin and noradrenaline. This might be why people fall asleep or feel a general sense of well-being after having acupuncture, and is why it can be very effective for anxiety and depression. The gait control theory. Have you ever touched a stove top and had it take a few seconds before you realize you're actually hurt and burned yourself? That's because the system that the nerves use to travel up to your brain is actually quite slow moving. So the signal that comes from your hand to go up to your brain takes a few seconds. Well, the nerves that acupuncture use are much smaller and faster traveling. So the theory is that the nerves that are stimulated with acupuncture send a signal of pain relief to the brain faster than the signal of pain can reach your brain. It ends up overriding it and you don't feel the pain. So let's switch gears a little bit and we'll think about Chinese medical concepts. Have you heard of qi? Qi can be loosely defined from Chinese to mean energy. And when we think about what is energy, I think a really good example is phantom pain. Have you ever heard of it? It's when someone has an amputation and they still have pain when there is no limb anymore. Western science is kind of confused about what causes this, but acupuncturists understand. Even though you remove a limb, you can't remove the qi. And when you do major surgery like an amputation, it's certainly going to block the flow of energy in that spot. So we do acupuncture around that area of the amputation and have had fantastic results for phantom pain. I think this defines pretty well what qi is. Meridians. These are the lines that the energy or qi travels along around our body. You can see them in this picture here along these lines. It might look a little bit like the nervous system or the circulatory system, but it's not. It's different. It's an energetic system. It can't be seen under MRIs or X-rays. But modern science is recognizing that there is a correlation between fascia, which is a thin membrane or connective tissue that covers our muscles throughout our whole body. It creates a web, and at the places where fascia overlaps, there's acupuncture points. They're thinking that this is how we send signals throughout the body, is over the fascia, and it seems to correlate with meridians. So the acupuncture points. Acupuncture points are found up and down the meridians. There's over 400 of them on the body, and it's where energy is supposed to accumulate, but sometimes it gets stuck, and that's why we need acupuncture to smooth it out. Yin and Yang, that's the Taoist philosophy of balance. Thousands of years ago, Taoists looked to nature to explain imbalances in the human body. So the terminology that we use as acupuncturists might sound a little bit more like a weather report when we talk about dampness, dryness, heat, and cold in the body. But we use this philosophical concept of yin and yang to provide balance to the body. So acupuncturists are quite qualified and are quite educated. After receiving a bachelor's degree, acupuncturists go on to do a minimum of a 3-year Master's of Science degree program. When they complete their master's degree, they can sit for national board examinations by the NCC-AOM. Then they have to register with their state and become licensed. Their state in the United States is then issuing a license to practice acupuncture, which they have to keep up every year with continuing education units. So I bet you want to find an acupuncturist near you. Well, I'd be happy to see you, but I'm all the way in Vermont, which might not be anywhere near you. So I've created a directory on our website. It's at acupunctureinvermont.com/directory. And this will take you to find all the NCC-AOM board certified acupuncturists in the United States. All you have to do is put in your zip code and how many miles you want to travel, and you'll find an acupuncturist near you. Maybe you've already been recommended an acupuncturist and you're wondering if they're qualified. Well, you can look at the letters after their name. Now, all the states in the United States, unfortunately, don't have the same letters after their name to signify a qualified acupuncturist. Most of them use LAC, which means licensed acupuncturist. But there's some other names out there too, including OMD, or Oriental Medical Doctor, DAC, or Doctor of Acupuncture, AP, Acupuncture Physician, or RAC, Registered Acupuncturist. I think if you start there, and then afterwards, just ask some questions and get to know your acupuncturist to make sure that you'll feel comfortable receiving your acupuncture care from them. Well, we've reached the end. I hope I was able to cover for you how acupuncture works, the history of it, what conditions it treats, and what a treatment is like. Thanks a lot for listening. I love providing these online learning opportunities, and we have more under our lessons section. So please check me out over there, where we can talk about essential oils, Tui Na, and more about acupuncture and herbs. Thanks.